Hi, I'm Shelton from Canon Medical Systems. MRI is complex, but simple explanations behind the latest MRI methods are always good to know. In MRI, sometimes just imaging anatomy is not the whole picture, and we need more, like changes in tissue properties resulting from disease processes. Let's talk about measuring tissue T1 values with the MOLLI technique for 2 minutes. Recall that the primary factors affecting MR images are the proton density and the T1 and T2 recovery times. Typically, we acquire images that are more heavily affected by one of those parameters, such as in T1 weighted or T2 weighted imaging. But sometimes, in addition to these weighted images, we need more quantitative information about those parameters themselves. There are many use cases where the information about T1 or T2 plays an important role in diagnosis, such as certain cardiac diseases. You probably recall that T1 refers to the time it takes for an excited spin to relaxed equilibrium, that is, the spin matrix relaxation time. Measuring T1 ideally takes a long time because one must wait for complete relaxation between repeated samples at various inversion delay times after the inversion pulse. But Look and Locker published a quick method which, following an initial inversion pulse, allows rapid samples to be acquired with very small flip angles as the spins recover. Then the effect of those rapid samples can be corrected mathematically to calculate the actual T1 recovery time. While common for research, this technique is still slow by today's standards, especially if applied to cardiac imaging, where data may be preferentially acquired only during diastole and repeated over multiple heartbeats. For this application, a much faster alternative called Modified Look Locker Inversion Recovery, or MOLLI, can be used. In the MOLLI technique, multiple cardiac-gated images are acquired during the diastolic phase, where cardiac motion is the least. In the first heartbeat, an inversion pulse inverts the magnetization. Then, in the following few heartbeats, images are acquired as the magnetization recovers, giving multiple images at different inversion delays. To obtain more inversion delay time points, a second inversion pulse is often employed with images acquired at different delay times. Once all the images are acquired and reconstructed, they are reordered based on inversion delay time. Then, on a pixel-by-pixel basis, the signal recovery curve can be fit to calculate the T1 of the tissue. If you want more information about how MOLLI is implemented and how it's applied clinically, including influencing factors and alternatives, then click on the link and download the attached Good to Know document. You'll find additional information, answers to some questions from the field, user tricks, and best practices. And if you like this video, hit subscribe to stay tuned for more simple explanations that are good to know.